Aisha Amin. She'll be discussing with us on global health workforce, task shifting, upskilling, and capacity building, SDG 3. She is the Vice President, Global Health Care College Sweden, Manager, Health and Social Care College Stockholm. Right now, let me welcome Miss Aisha Amin. Back to you. Your stage over here.
Thank you so much, Dawn, and it's an honor to be here at the Global Sustainable Development Summit of 2022. Let's see. I would start to share my screen. Is my screen visible?
Yes. Could you share the slide share with us?
Yeah, thank you so much.
Thank you.
Yes, I'm the Vice President of Global Healthcare College Sweden, and together I work closely with Britta Wikman, who's the CEO, and Ulrika Nimstrand, the COO. And together, our vision is to create high-quality healthcare on a global scale, mainly focusing on the health workforce, working closely to the patients. And together we provide consultancy services for healthcare providers, tailor-made educations based on research and proven experiences and best practices, as well as quality assurance for healthcare settings. We are a member of the Swedish semi-state-owned organization called SweCare. And we have a network with a global network with the governments, ministers, universities, and other stakeholders within the health and social care. And I would like to take you back to 2014, actually, where our journey started. We have just returned to Sweden from a trip to India, where we have visited like 30 different settings within the Delhi area, such as governmental and private hospitals, elderly care homes, homes for people with different disabilities, universities, and schools. And what we could identify was that there was a huge need of and interest to collaborate and work together to strengthen the health workforce, working closest to the patients, such as paramedics. And so that is actually the foundation of our company, that we are focusing to strengthen the health workforce globally. And we are taking from our experiences from the healthcare, as well as tailor-made educations, and as well as best practices, how we have been working with this challenge globally, both in Sweden, that we could see in the early 70s, the need of to strengthen the health workforce due to the shortage of nurses. So the new profession, assistant nurses, was implemented to assist nurses in daily nursing care procedures, as well as medical procedures. And we also know that the implementation of the community health workers in the end of the 70s has helped to improve the health in many countries, both when we are talking about maternal health, child health, improving the infections indicators to lower them as well, but also best practices from working to strengthen the academic professions, such as nurses, by using the strategy of upskilling and task shifting. For example, in Tanzania and Mozambique, whereas nurses had been trained for a 3-year program to conduct tasks normally conducted by doctors in rural areas, for example, like cesarean sections. And this is an urging challenge to work to strengthen the health workforce. And we know that there is an estimated shortage of the global health work up to 10 million by the 2030. And some regions have been pointed out specifically, such as Africa, Eastern Mediterranean, and the Middle East. But we know that this is not just a challenge for the low and middle income countries. We can already see the need of the health workers, especially like nurses, specialized doctors in the high-income countries. So that's why the need to work on upskilling and task shifting strategies is so important. And we also have a growing elderly population and societal changes, specifically due to the climate change and as flooding, increasing the number of cholera outbreaks, for example, as well as droughts, adding on the malnutrition and for example. We also have an increase of non-communicable diseases due to urbanization as well as dietary changes. And for today, 70% of all people living with non-communicable diseases are found in low and middle income countries. So, and pandemics adding on the big challenge to the health workforce. And the limited capacity for educational programs. So our vision about to create high quality healthcare for a sustainable future by letting the United Nations Sustainable Development Goals guide our work forward, focusing on our core values, whereas to provide quality healthcare educations, both for paramedics and academics, such as nurses and doctors, by focusing on the health workforce. And equality is our second core value by aiming to strengthen the equality, both by gender equality as well as focusing on to strengthen the youth and the women. We know that that is a success factor to strengthen the health workforce, and that will lead to work also towards health for all, as we know that health workers provide preventive, curative, and palliative care for the population. And how shall we reach this? By empowering the health workforce, we also need to work towards a close collaboration with other stakeholders on local, regional, national, as well as the international level. And to do so, we have a close collaboration with our partners in India since 2020 with Skilled India, which is a joint venture between Kunskapsskolan and Manavrashna, as well as the National Association of Healthcare Providers in India, which who have 11,000 member hospitals within their network, reaching out to 20% of all the hospitals in India. And together we have joined hands and created a robust base where we can provide and offer healthcare education for allied health workers as academic professions in close collaboration with other experts within the field, and scalability as well. And I would like to point out two examples how we have been working towards the SDGs, as well as to create capacity to educate the health to provide high quality educations for the health workforce. And we have developed like infection prevention control education for nurses, as well as hospital manager education. But I would like to start to highlight the general duty assistant program that we have been working to develop further, as it's a national standardized program in India. It's a one-year program with 3 months of theoretical content and 9 months of in-house training. And out of the 21 national occupational standards, we have comprised these to 11 learning units on a digital platform that has been developed for the trainees, as well as a platform for the trainers. So the education can be conducted in hospitals or other healthcare facilities, or in specific educational providers. And it's built on 3 different steps, where this first step is gives an introduction to the learning objectives with pre-diagnostic assessment. And the second step consists of theoretical content, where we have developed videos, animations, theoretical content with checkpoints and theoretical exams. And the third step is related to a practical task, where the trainees conduct a practical task that can be, for example, to measure medical parameters of the patient, such as pulse, blood pressure, saturation, and so on. And after the 3 months of theoretical training, they are doing 9 months of in-house training, and afterwards they are conducting their final exams, so that they will also have a certificate from us, as well as from the government. My other example is how we have been working during the pandemic with the COVID Frontline Worker Program, which actually was a national implemented program by the government, a 3-month program, where to scale up and to strengthen the health workforce working closest to the patient. So what we did was to further develop the program, putting extra emphasis on patient safety, the health workers' safety, infection prevention and control. And during a couple of months, we offered 3 different levels of the program: basic for freshers, starters with little experience of the health care sector; the advanced program for those who has more experience, for example, general duty assistants, as well as for the home care program for those who wanted to work in home care settings. And the majority chose the advanced program. And in total, 3,000 trainees underwent the program, and 170 trainers across 55 hospitals across India. So what we have learned from this is that we have the capacity to scale up and provide quality healthcare educations for allied health workers, as well as academic healthcare workers like doctors, nurses, for example. And our next step is to, by 2023, train 3,000 uncertified general duty assistants, and between 2023 to 2026, train 20,000 uncertified general duty assistants on an annual base, and that's for India alone, because we know that there are up to 8 million untrained, uncertified general duty assistants in India. So we know that there is a big need. And we are also offering our services to specifically low and middle income countries in the Africa, Eastern Mediterranean, Southeast Asia, and Middle East. And for the moment, we have initiated a dialogue with potential partners in Rwanda. So how do we reach our vision to create high quality healthcare for a sustainable future by focusing on the health workforce and our SDGs? So our way forward, the key areas for actions pointed out by WHO will continue to guide us, whereas to scale up the digitalized planning and to secure financing, as well as to offer high quality healthcare educations for the health workforce. And we know, and to work so that they will have higher possibilities to get deployed, because we also know that there are challenges to absorb all the health workforce in some countries due to the mixed challenge to the too little educated health workers. So, but as well to work to protect the health workers by putting extra emphasis on patient safety, health worker safety, and infection prevention control, as well as to strengthen the performance, looking on facilitating factors for the health workforce. So with that, I would like to thank you so much for your attention, and you are mostly welcome to contact us on info@globalhcc for further dialogues. And one cannot do all, but together we can do more. So thank you so much for listening.
Wonderful. Wonderful, Aisha. This was a beautiful, very well planned experiment that you have illustrated and shown us. And I'm sure that you will go a long way with all the partners supporting this beautiful initiative. Without wasting